Drug information is both about individual drug products and the drug-related information about them, but is also the practice of drug information, which is practiced every day in every setting by pharmacists, providing drug information to patients primarily, and then of course to other healthcare providers like physicians and nurses. Drug information practice is also a specialty of pharmacy, and here we see pictured a drug information center. Many drug information specialist pharmacists practice in DI centers at academic medical centers or at industry or even at corporate like large chain retail stores. They will have a drug information center as well. Some of the most common drug information question categories that you'll encounter as a pharmacist are listed here. They vary a bit depending on whether you work in more of an inpatient or an outpatient setting. In the current course, we are focused on emulating an outpatient setting. And of those types that are commonly encountered this semester, we're going to focus on these three question types, which is product information, indication or use of a medication, and information about dosing and administration instructions. In the brief reading, you saw that we classify literature as primary, secondary, or tertiary. When we begin a search for drug information requests, we always start with tertiary literature because this condenses a lot of information, and if we're lucky enough to find our answer there, we don't need to proceed any further. The topic of this module is about compendia, which are a type of tertiary literature, and they're the reference that pharmacists use the most in frontline practice. Later in the course, we'll be introduced to the wide breadth of different references that you'll use as a pharmacist. But as way of kind of some general context, all of these are tertiary resources, so they're reference or review materials, and they can be organized in a couple of different ways, both by how deep the information is, as well as whether the reference has more of a drug or a disease focus. Of the drug side of things, these are really our compendia, which you see listed here are some of the most common ones in pharmacy practice that you're going to encounter. We refer to three of these as the big three, and we will come back to that in just a moment. On the disease side, there's many different resources, some that are by subspecialty of medicine, and some that are more drug-oriented, which you see down towards the bottom of the screen. So I mentioned those big three. At Pacific University, you have access to all of the compendia that are shown there on the left, but the big three are really the workhorses of pharmacy, and these are the three that we're going to teach you how to use and you'll become very comfortable with over the course of your pharmacy education. So now I'm going to pause and switch over to the library so that I can show you where to locate these compendia, as we'll be using them in researching our drug information questions. I suggest that you bookmark the databases or compendia that we will be using frequently. If you haven't already done that through orientation, let me navigate you there really quickly. So this is the main Pacific page. From here, you would go to Libraries. And then this is the library's main landing page. If you enter the name of one of those compendia here, it would lead you to it. But there's actually a faster way that you may want to bookmark for future use, which is how I've set it up for myself. So you'll go to Databases here. And now this is showing you prearranged lists of databases by subject. And if you choose this drop down here and look for pharmacy, now I would then bookmark this address for future use, because these are all of our databases that you're going to be accessing the most frequently. So it's a subset of the total holdings of the library, but the one that you're going to use the most often. For example, here's Access Pharmacy, where many of your online textbooks are stored. So you can either scroll, because there's only about 24, or you can use the lettered tabs here. So for example, one of our big three is called Facts and Comparisons. And here it is, and right from here you would direct link out to that resource. Our next one was called LexiComp. Again, you can direct link out here to the resource. And our final one is called Micromedics. You can see here we have to choose from the available options, but here is Micromedics. And if we click on that, for example, it will take us into the full resource. In the next module, you will get some practice accessing and looking up some basic things in each of these 3 compendia before we have our face-to-face session. See you then.